Hello, class and Professor Williams. My name is Latina Marsh, and today I will be ruling in favor of the plaintiff for the case number 4, Dentist Revises Process to Safeguard Medical Alert, PHI. The healthcare organization that is involved today is Bright Smiles Dental. Now, there have been some ethical issues with this company that we would like to discuss. Today, ethical principles in healthcare state that healthcare ethics is a set of moral principles, beliefs, and values that guide us in making choices about medical care. However, in this case, ethics were not considered due to the act of staff flagging patients' charts with red stickers for AIDS and HIV patients. This to me allows unauthorized persons to have access to people's charts. As people approach the desk at this dental office, charts are lying around on the counters, and if there's a red flag that clearly has HIV or AIDS stated on that, these persons' PHI is being exposed, and it's unfair and unethical to the individuals that Bright Smiles has taken care of. HIPAA was put into place in 1996 and protects, or is supposed to protect, protected health information. Healthcare information means any information, whether written or oral, or recorded in any form or medium that is created to receive by a healthcare provider, employer, and relates to the past, present, or future physical or mental health or conditions of an individual. The provisions of health care to an individual or the past, present, or future payments for the provisions of health care to an individual. Now I would like to discuss 4 rules of HIPAA. The first rule of HIPAA is the privacy rule, which states that every person has the right to control their personal health records, and each business and its employees are responsible for keeping an unauthorized persons from viewing patient files. The health files are now written, stored, and shared orally, electronically, and on paper. So a lot has to be done to keep these records out of the wrong hands. Also, another thing that I would like to discuss dealing with patient records. When you're dealing with paper charting and all the charts are stored into a room, it's easier for not patients, but it's easier for employees or anyone else to access these people's records. So say, for instance, there's someone working with the patient and they happen to see this chart flagged with a red sticker for AIDS or HIV. If this happens, any staff member is capable of opening up a person's chart, finding out who this person is with their medical record number, their account number, their address, their social, their name, date of birth. Any of this information is left in people's charts. So when somebody opens up this chart, no other healthcare professional can figure out who has been in a patient's chart or what has been accessed. Some people also believe that since this information is right at hand and readily available to them, that they cannot get in trouble for opening or accessing a patient's chart without permission or without dealing with this patient one-on-one. Another rule that we'll talk about is the HIPAA security rule. This rule relates directly to electronic patient files and states each covered entity, which includes dentists, must keep them safe from any authorized access during transit or storage. This goes back to what I was just talking about. We have to make sure that patient information is not getting disclosed or people are not accessing these charts without the correct protocol. We're not supposed to be accessing anyone's chart unless you're dealing specifically with that patient. And even then, after that chart is closed, your memory should be erased and everything else dealing with this patient. It should not leave the facility. So people get in trouble for simply just talking about something that they seen in someone's chart. Another rule is the HIPAA breach notification rule. The breach notification rule requires all covered entities and business associates to give notification when breach has occurred in relation to unsecured, protected patient health information. So whenever there's a breach in this notification rule, someone should be notified, especially when you have paper charts, because with electronic charting, healthcare professionals or other investigators are able to go in, see who accessed the chart, at what time these charts were accessed, your initials or anything else that follows behind your trail will be able to be accessed through these investigators, because with electronic healthcare records are better kept up than paper records, because there's a trail and you can find out who has had access to what, and it can show you back to the person that opened or accessed this person's chart at any time. Another rule is the patient safety rule. The first rule protects identifiable patient health information from being used to analyze and improve patient safety and events relating to patient safety. Now, to me, I would have to say that this was intentional violation on Bright Smile Dental's part, because it allowed for people to be able to snoop or to look into someone's chart by flagging it with a big red sticker stating that the person has AIDS or HIV. My suggestion to Bright Smile would be to transfer to electronic health records, because you can trace back to people that have accessed these records, and patients will feel more protected if their information is stored electronically versus with paper, because paper, there's not a trail with paper, and you can't figure out who has done what or who has opened up a chart and accessed the patient's chart without their consent. So again, I would like to say that I rule in favor of the plaintiff for Safeguard Medical Alert PHI, and I believe that the plaintiff should win this case. Thank you.